Hello, everybody. My name is Michael Ibbott, and today we're going to be doing a presentation on women's wellness. I would like to be able to just make sure that if you have anyone in your area that is actually a minor, there will be some graphic images in this presentation, and I want everyone to feel comfortable, but if you do have minors sitting by you, please keep them busy with something else while I do this presentation. So today we are sponsored by Derme&Co, and as before, I'm going to be sliding my slides. I'm going to be scrolling because the system I'm using unfortunately doesn't allow me to flip from screen to screen. But the presentation today is presented by Nelly de Vust and sponsored also by Derme&Co, who is based in Montreal, Canada. So Derme&Co, just to go a little bit over with regards to the branding of Derme&Co, it is a distributor of several brands. Some of you may be familiar with already, but Nelly de Vust, an established brand originally from Belgium, now manufactured in Montreal, Canada, and certified by Health and Welfare Canada and the FDA in the US, as well as whichever relevant countries we're distributing to. They are under direction by those countries or governments to be certified as well. So we in the lab, Nelly de Vust, believe that how science and nature should go hand in hand. So to consider women's wellness is really to consider that how we are unique in the sense of a species that are able to analyze information. And we have to appreciate that how every aspect of our body is actually related to each other. So with regards to women's wellness and health, if you are an esthetician and you are looking at the skin, you should try to consider that how everything working together will be related to how the skin actually looks. So the obvious is if you are using anything to affect the skin, it may be something relevant in terms of trying to appreciate that if a woman is in balance or out of balance, and in fact, even the males, let's not be sexist, but even males, if there's something out of balance, it could be visible on the outer surface of the skin. So to respect that how everything working together with the environment, working with our bodies, Nelly de Vust is famous for the active ingredients being naturally derived, and the active ingredients are distilled in a method called the diadermic method to have a dramatic effect in how we actually transform the skin. So this is also true for the body. And if we're talking about ingredients that will be relevant to the body, the line is comprised of organic ingredients, and the ingredients that are listed here for your benefit will be derived from sources found all over the world. So we have certification, the EcoCert certification that you may be familiar with, but this certification allows you to appreciate that how anything that we are utilizing is sourced from safe environments, so that how there is no negative aspect to the ingredients and how they may affect the skin or the body. So for women's wellness, we want to consider several factors: the anatomy, the physiology, and the imbalance of the intimate region that we are talking about today. So anatomical structures have to be considered. And when we are looking at the external components for a woman, just to make sure that people know what they're talking about, a lot of estheticians that are in the business may be doing depilation techniques where they're doing Brazilian bikini waxing. So they may be familiar with this, but maybe they're not. And for those of you that are actually in the medical field, this is just to reinforce some of the things that you should already really know. So with regards to external genitalia, we're talking about the labia majora, which are also called the large lips, and the labia minora, which are called the small lips. And since these are areas that are external, the products that we are going to talk about a little bit later, this is where we will be recommending that you use the products. Nothing is being used internally. So with regards to external genitalia, of course, the image is here for you to take a look at. But what we want to do is to reinforce that since the internal aspects with regards to the urethra, the urinary tract, these are to be considered with regards to how excretion in genitalia or with genitalia works. You need to appreciate that how when we are talking about these specific areas with our clients, it might be wise for you to have a visual chart like the one I have here, so you can show them the areas if they're interested in knowing a little bit more about it. So the role of the labia minora, or the small lips, is really helping to protect the urethra, the vagina itself, and the clitoris against the world that's coming on the outside. So since there is discharge coming in this area, the main thing to appreciate is that how there is a buildup, which is called smegma, S-M-E-G-M-A. And this is a combination, as we have here, of dead cells, fluids, and basically the result of this buildup combined with moisture can lead to, if the area is not sanitized or cleansed properly, can lead to a buildup, which can cause discharge or odor. So internally, we have to appreciate that the female part of the human species, this is a person that will potentially be a mother, and the ovaries, the fallopian tubes, which are now called the uterine tromps, the uterus and the vagina are what we are talking about. So the primary goal of the ovaries is really to have eggs, and those eggs will be produced to join with sperm and become an embryo. So the internal system itself, a woman is born with hundreds of thousands of eggs, and as she develops into an adolescent, those eggs will start to become potentially, if they're joined again with a sperm, an embryo. So when we talk about the fallopian tubes, where the eggs are coming down the tract, this is where a woman becomes, or a child becomes, a woman. So the uterus, the area between the rectum and the pelvis, is where an embryo would potentially develop. And as the embryo moves down the uterine tromps, or the fallopian tubes, problems can occur if there is actually an embryo developing in that area, and this becomes an issue with regards to a very difficult pregnancy. Now, just a little bit of a reminder, this is really something I want you to be thinking about. If you are an esthetician, you're thinking about what a woman has to go through with regards to her life cycle. If you are working in the medical field, or you're an OBGYN, or anybody that's actually working in medical aesthetics, and you're utilizing a laser for depilation as an example, it is important to consider that how a woman going through, let's say, their menses, and they're a little bit more sensitive, just to understand the relevance of how the body actually works can make a big difference with how you communicate to your clients. So in the physiological state and the menstrual cycle itself, when an egg is traveling down through the fallopian tubes, again, it's called the sorry, a little bit of a brain issue there. But when the egg is moving down the fallopian tubes and it starts to mature, a woman will go through a period of time in their cycle where they will be a little bit more on the sensitive side. So it takes about 7 days for the eggs to travel down through the fallopian tubes. So the ovarian cycle, which for most women will be about 28 days, of course, it can be a little longer or shorter for some, but the average woman is going through with 28 days. You want to consider their sensitivity issue around that time of the month where they are a little bit more hypersensitive. So when we look at the menstrual cycle itself, from the 1st to the 14th day, the follicles begin to mature, the ovarian follicles begin to mature, and a woman is going to secrete a little bit more estrogen, which means that how they're going to be a little bit more on the sensitive side. This can lead to issues with mood. This can lead to issues with hypersensitivity. But the main thing here is the estrogen cycle is actually starting to become a little bit higher. Because changes that are occurring in the body psychologically as well as physically, it is important to appreciate that how all of this in terms of transition is occurring quite frequently over a woman's life cycle. And this will make a big difference with regards to what you can actually do to help them. So we're going to talk a great deal about pH. And this is part of the issue with when you're actually asking your clients to actually test themselves by just simply saying to them, do you know where you are in your cycle? And sometimes you do, sometimes you don't. But the main thing is that how the relevancy will be the shift internally will make a big difference to how their body's going to be responding to something as simple as a pH test. So in menopause, which is for most women starting in their 40s, and sometimes a little bit later, the shift estrogenically is where the body itself starts to become deprived of the amount of estrogen that they used to have when they were younger. So the shift in the estrogen relative to the progesterone and testosterone will start to create some issues potentially with the vaginal area becoming drier or more hypersensitive, depending on what type of stimulation that we're talking about. But most importantly, it could lead to discomfort for your client. So whenever we are going through with our clients and discussing where they are in their life cycle, some of the symptoms that they'll be talking about or complaining about, such as flushing, mood disorders, intimacy difficulties, signals to do with how their joints or their bones are feeling, since we know a lot of women that are going through menopause will have issues with osteoporosis or heart disease. All of these things are related again to the shift of estrogen through the body. So with regards to vaginal pH, just to be clear with what pH means, pH is potential hydrogen. So when we measure the pH of the vagina, the difference between the vagina and the gut, which is what most people will be familiar with, is really the scale of pH, which goes from 0 to 14. So if we're talking about the gut itself, the pH of the stomach should be 7. The pH of blood is 7.3. The pH of tap water, if you're living in a city, should be 7. So when we're talking about the pH of something, we have to differentiate between what pH we're actually talking about. So right now in the marketplace, what is very fashionable is to talk about the pH of water. Drinking water, not from the tap, but from a bottled source that has a higher pH, like 8.2 or 9.2. This marketing of water with a higher pH is really meant to be for people that have issues with acidity in their gut, to bring the pH back to a normal range. And the reason for that is usually the dietary aspect of that individual might be creating stress within the gut, leading to a more acidic system. Vaginal pH is already acidic. It's actually ideally in a range between 3.8 and 4.1. So the vaginal ecosystem itself, which we call the microbiome, already has the good bacteria and the bad bacteria in balance. And from birth, the vagina is colonized with microorganisms, as we actually have listed here. So I'll leave this little page up here for a second, just so you can see exactly all the things that you can consider. But the main thing is that how the microbiome of the vaginal area from birth through to adolescence can shift because of what a child or a young woman is actually using to look after themselves or not using to look after themselves. But it is affected by what's happening in the gut itself. So when we talk about the vaginal ecosystem and we talk about the shift, as I mentioned previously, with regards to the estrogen and how it's changing through ovulation, whether it's in menses or whether it's post-menopause, the bacterium itself, or the good bacteria, the bad bacteria, all of these things are always fluctuating because of something that's happening to a woman from a natural physiological perspective, but also from an environmental perspective. So during adolescence and puberty, this is where you see a disturbance because of the shift estrogenically. So with regards to the vaginal ecosystem, because the pH is naturally acidic, the dominant bacteria is Lactobacillus bacterium, and this particular bacterium is responsible for the area being acidic. And this is why the vagina is considered self-healing. So when a woman is within the 3.8 to the 4.1 range, which we consider to be within the normal range, when they are a young adolescent, 11, 12, 13, they could be as high as 4.5. So my suggestion is actually to give a strip and this information chart with instruction in the back. You want to gift it into a little Ziploc. And for those females that are coming into your environment, if you're doing a bikini wax as an example, or you're talking about their acne, which is related to how the body is actually functioning, acne rosacea or acne vulgaris, by suggesting that they do their own little personal test, will give them a little bit of insight as to what's going on with their body. So you want to relate the vaginal area to everything else you're doing within your environment. So the instructions in the back of the chart will give you a guideline with how to do it. So for the Lactobacillus bacteria to be dominant is relevant to the pH itself. So why does it really matter? Because health matters. And if we're talking about a woman's responsibility to herself, it is to understand what it is that's going on with her body in every aspect. So the healthy bacteria that's actually dominant in the area will help to prevent the proliferation of yeast or mold, but also other things that may be entering the body from actually proliferating. So we want a fight response, not a system that's actually struggling to keep the body in balance. So the change in the pH can be altered by these things we've had listed here. A lot of women are taught at an early age to use things that are more detergent-like for cleaning their bodies, or if they're having anything inserted in their body, whether it be for their menses or whether it be for any sort of stimulation, it may shift the balance, and as a result of it, it creates an issue with stress to the area. Naturally, if a woman is choosing to have a child, this in itself will create a fluctuation within the pH, and your child, if you're doing a vaginal delivery, may have a disturbance on their ecosystem because the body itself is not in balance. So the relevancy to understanding and appreciating pH will be the outcome of whatever you're doing to choose for your particular life. So the higher the pH, the more the bacteria itself can proliferate, as I mentioned. So the smegma itself can have an odor because the combination of an internal pH that's out of balance can lead to the smell, can lead to the discharge of fluids that are not necessarily clear. So it may be white, gray, or green. And there could be symptoms like itching or burning when you urinate. So we differentiate between a urinary tract infection, a UTI, versus an imbalance internally, which is relevant to the pH itself. So the pH itself, because of the estrogen deficiency, that will happen during menopause or medication, can also be accelerated by a choice with wearing tight garments, going to a pool, going into a beach, having changes in the area because of exposure to either alkaline or very acidic environments. So when your pH is shifting and it is going out of balance, we have to give information to our clients so that how they can look after themselves. And in some situations, because we're not talking about sexually transmitted diseases or sexually transmitted infections, those are things you may want to have information available to your clients so they can practice safety with regards to how they dictate or they look after themselves. So please think about having information for your clients. Some of the things that your clients may experience, such as vulvitis, the inflammation of the vulva itself, can lead to irritation. This will make a big difference if you're doing any sort of depilation. And the common symptom is generally burning and itching and the change in the discharge. So if you are doing any sort of depilation in that area, if you are seeing any sort of hypersensitivity or anything like this, you may want to consider not doing your depilation at that time, but talk to your client about what they can be using to look after themselves. So the infection in an area with vulvitis can also be to do with how mold or lichen is actually becoming involved in the area. So this will lead to other symptoms such as dryness and cracking of the labia itself, and any sort of warts, anything that would actually be something that you need to back away from your service should be something that you consider if you see or observe any of these things for your clients. They may not know that they have it because they haven't actually looked. So you can be their guide with regards to how their body is appearing. In terms of a normal discharge, if it's becoming gray, milky, or green in color, the body can be dehydrated. So there's not enough intake of water into the system. And a lot of people don't drink water. They just drink their coffee or go without water. And this will make the discharge a little thicker. So you need to explain why water is so important for general body health, but it makes a big difference with regards to the discharge of fluids. And abnormal discharge can be caused by stress. So we go back into last week's conversation with regards to body health, why it's so important to talk to your clients about stress and how it's affecting the system itself. It makes a big difference with digestive stress, which may alter the pH within the digestive area, but it will also make a difference with regards to the overall wellness of that individual, triggering a hormonal shift, sometimes leading to an imbalance where the estrogen itself is just depleting or reducing because of how the parasympathetic and sympathetic nervous system is being challenged. So with regards to the ovulation cycle for a woman in terms of a normal discharge, you will get a lot more when you ovulate, obviously. And if you're having any sort of intimacy, you'll have more discharge. But during pregnancy, the shift will change. So you're going to have a little bit more estrogen. And if you are actually taking any sort of birth control, this will create a shift with your body as well. And to discuss in your consultation what they're choosing to do, whether it's with birth control or just abstaining, or where they are in their life, will make a big difference for that individual. So I'm going to flip through a little bit of these charts so that how you can actually make a note of some of the discharges. If you need more information with regards to some of the slides, just get in touch with our customer service department and they can help to facilitate the information that I'm not able to go over completely. But the important thing is whatever you are doing with your clients, there is a cause and effect to everything that this person may be experiencing. And one of the biggest problems that we have to deal with is actually Candida albicans. And this is actually because North Americans specifically have a very high diet in sugar. And the Candida albicans is actually a fungi that thrives on sugar. And this creates a big shift with regards to how the body is actually being altered. And frequently, because the diet needs to be considered in terms of how to change the proliferation of the Candida albicans, when you actually measure the pH of a female, if they are above 4.1, 4.2, again, you're using your pH strip and you're using your chart to give you an indication. If the strip itself is actually getting into the red range here, then you are actually becoming more alkaline. And the more alkaline you become as you go into your teenage years, your 20s, your 30s, 40s, and 50s, the more alkaline you're becoming, the more out of balance you really are. So the choice for that individual is to appreciate that how, if you are becoming out of balance, and bring yourself back into balance will mean that the proliferation of these things like the Candida albicans will start to diminish. So with regards to vaginosis, or this discharge creating an issue with odor, again, it's all to do with the pH. We want the good bacteria to be more dominant. Again, it's the lactobacillus bacteria. We want the yeast to be reduced because it makes a big difference with regards to itchiness, irritation, and sensitivity. And if the discharge is there and the undergarments are starting to stain, these are some of the things and just in observation that your clients may be experiencing. So the yeast, the mold, all has to do with the pH, because you're dealing with some of the issues with the Candida. To avoid the sugar intake or to reduce the sugar intake, reducing things like fruits that are high in sugar, such as bananas or mangoes, cakes, anything that's very high in carbohydrate balance. A lot of people eat white rice or a lot of chocolate. They're craving chocolates during their cycle. This can create a shift with the pH, and as a result, a problem for that individual. So sugar is a big problem. Anybody that's taking an antibiotic will create a shift in terms of digestive pH, because everything is usually eliminated when you go on an antibiotic in terms of your gut health. So you need to bring probiotics into your life. And probiotics could be obviously in the form of yogurt, but prebiotics are also very good to introduce, such as fermented foods, like sauerkraut as an example, and this can help with the natural balance in the digestive system. And most importantly, you should be talking to your clients about their stress levels. So think about those three things and what causes them and the responsibility that a person has to look after themselves. So further to that, we talk about the choice with regards to what you take to regulate your system, and medical issues that you may have genetically predisposed or may be influenced by poor dietary choices. And when we look at studies that are done within the US, we know that 61% of women who take birth control pills develop conditions such as vaginal candiditis. So with the proliferation and the pH becoming out of balance, where the digestive tract is more acidic, to bring it back into balance will make a difference with regards to the proliferation of the bacteria. And because you are moving your fluids through your body, absorbing it into your bloodstream, it can ultimately affect the appearance of the face. And we see an appearance of things like acne rosacea developing because there's a lot of candida within the system itself. If one is wearing tight garments, the restriction in the area can lead to stagnation of movement or fluids building up. And as a result of it, you have a shift of fluids coming from the backside to the front. So if you're wearing thongs, as an example, you can have E. coli moving from the rectum to the vaginal area, and again, triggering an imbalance within the area. And most importantly, because a lot of the choices with regards to what's available in the market contains scent, so that how women feel fresh or smell fresh, these things that are synthetically derived can create an imbalance because they're really not meant to be there. So you want to educate your clients with what they should be using or not using for the proliferation. And lastly, with regards to pregnancy, just as I explained earlier, it is the natural shift estrogenically that will trigger the imbalance. And as a result of it, a woman could be experiencing things that they don't necessarily need to experience. So again, if you're talking about the foods to avoid, high sugars, grains that are very high in gluten, such as wheat, meats and fish that are not necessarily organically sourced but may have toxins within it, and dairy products, specifically products that are high in lactose. Some cheeses are not high in lactose, such as goat cheese or some of the harder dairy cheeses like cheddar. Nuts that have gone bad, seeds that have gone bad. Sometimes just by smelling them, you can know the difference. But even some of the oils that have gone bad, that are part of a daily diet, people should be checking these to make sure that they're actually still stable, because it can make a big difference with regards to how the candida will proliferate. And absolutely, and most importantly, anything to do with sugar. So alcohol, in most cases, contain a fair amount of sugar. We're talking about wine, beer, ciders. And at this time of the year, meaning winter, a lot of people want to indulge a little bit more, especially during the holidays. So they might have a proliferation of candida simply because of the choices they made over the previous season. So anytime there's a holiday, there's usually a lot of foods rich in alcohol, rich diets, and this can trigger an imbalance. So the foods you want to choose, especially dark leafy greens, will make a big difference with prebiotics. This will help the good bacteria to proliferate, and non-starchy vegetables can make a big difference as well. So when you're having things like zucchini or spinach or kale, sometimes you need to make sure those foods are actually slightly cooked, so that you can actually have the benefits of the essential vitamins or minerals that are in that food. So follow good common sense with regards to what it is you can choose to bring into your diet if it's a concern. And to avoid some of the things may be difficult, but if your system is out of balance and you've been suffering for a really long time, this is a good bit of information that you would want to provide to your clients so they can make better decisions as to how to look after themselves. So without further ado, I want to explain to you what we have available. And on the marketplace currently, a lot of people will be choosing products that actually have ingredients that are not necessarily compatible with how their systems are working. So do read the ingredients of the products you are actually choosing, because sometimes they are not doing what you want them to be doing. And part of it has to do with the chemicals that are actually found in the formula. These are just some of the formulas that are available on the marketplace that people would be familiar with. So not to discredit a formula, but there is a choice that a person makes, and it's not always the best choice. So we are introduced the line called BioFem, which is an organic formulation. And the formulas themselves, again, they are made in Canada, in Montreal, Canada. They are health and welfare approved, as well as FDA approved for the American market. They are vegan. So there are no animal ingredients. There's no honey in the formulas. They are free of GMO ingredients. They are gluten-free. So this, for the person that is hypersensitive to dietary aspects, should be aware about it. And most importantly, it all respects the balance of your pH. So if you are testing your pH with regards to home measurement, most importantly, when you're using the pH strip, this does not go into your tongue. or underneath your tongue. There are pH strips to measure the fluids that you're excreting in your mouth as well as in your urine. So when we're talking about those fluids, those pH strips will measure, and ultimately if you're imbalanced, you're looking for a pH of 7. So when these strips are being used, you need to insert it between your major and minor labia. You do it before you shower or before you urinate. If you do it after showering or after urination, you're more than likely you're going to be higher in the pH, because urine ideally should be 7 and water should be 7 as well. So it's neutral 7, but it's too alkaline for what we want to consider with regards to the pH balance. So again, it's important to do the test without any fluids. And the studies have shown that how a normal range between 3.7 or 3.8 to 4.2 will be for a woman past adolescence. So between 4.2 and 4.5, which is the zone where you're more alkaline, a child can be as high as a 4.5. But a young adult, if they're within the 4.2 to 4.5 range, pathogenic mold can actually start to form. And anything over 4.5, we have the proliferation of other pathogens. So you're out of balance. You're becoming too alkaline. So the Food and Drug Administration, they have on their website what a pH test is for, what it does, and it can explain the goal of pH. So some of the things I've already said with regards to the scale between 1 and 14, with 7 being the neutral range. If you're more on the acid side for vaginal wellness, then you are going towards pathogenic growth. If you're more on the alkaline side, below 3.7, that's also not good. You may have issues internally that you may need to talk to your OBGYN about. So Candida albicans, it can be eliminated within 7 days. We have the studies done with a formula that we have, which is called zone control, and it works immediately to change the pH of the area by eliminating the mold. So the choice is, if you have pathogenic bacteria or discharge, and you're using things that are not working, or maybe you have an internal imbalance that you're not aware of, there is a solution that is organically certified to help to change the way the body is working. Some of the things I'm going to be talking about, I also want to address how you actually deal with it. Let's say you're doing a depilation, Brazilian waxing. As an example, here in the protocol to help with affecting the candida or the imbalance in the area, which is the formula called zone control, we've also listed here a formula called cleansing foam. So when we talk about any of these formulas, there are things that we can actually use to change the balance. So cleansing foam itself will actually be discharged. It will look like a white foam. It will look a little bit like meringue. The cleansing foam can be used on a damp piece of gauze, and you give it to your client to actually clean the area before you do a depilation. So what's important about this? Number one, you're removing some of the surface impurities that are there for your client. You're also helping to eliminate any sort of odor that may be going on in this area. So you're introducing a product. Secondly, you're introducing something that they can be using at home. So if you are introducing zone control in terms of a 1-2 formula, the zone control will be working to kill the Candida albicans. So within 1 to 7 days, you can have a shift in your pH, which means you're going to need to provide a second strip or a third strip for the client to self-measure, so they know exactly what's happening to their body with regards to the pH disturbance. If you have gone through and shifted the balance, the page that I have shown here is how you actually maintain the area after you're done the hard job of bringing your body back into balance. And just a little note here, you can actually be going out of balance frequently. And if you're a woman that's having that experience for whatever reason, whether it's through menses, whether it's through intimacy, whether it's through garments you wear or exercise, there's so many different factors. You may be having to use the zone control occasionally, and the shelf life of the formula is 1 year, so they may be using it as they need it. But to maintain the balance between using zone control or after you've gotten to where you need to be, it's actually formulas that will have prebiotics within it. So we have the formula called pH soothing gel or pH balancing gel, and we have the formula called firming gel, which will contain active ingredients to change or shift the area. So the cleansing foam itself has an ingredient which is called alum stone powder, and this is going to help with wicking away moisture. So if you're doing a depilation procedure or you're doing any sort of laser hair reduction, I suggest using it for sanitizing the area, but also to remove any excess moisture so that you can get to your procedure. It would also be in situations where you have male clients that are doing depilation, though the formula itself is not for a male or in terms of genitalia, it can be used around that area as well too as a cleansing agent. Zone control, as I mentioned, is for the Candida albicans to reduce the proliferation within 1 to 7 days. And the active ingredients that you're looking at here is hawthorn. Hawthorn will give the color of the formula, which is a dark reddish brown color. So it is, again, a naturally derived, organically certified formula, and a little bit of salicylic acid here to help with getting rid of some of the buildup of the smegma, but it will make a big difference with regards to the overall balance within the area. So they do need to do another pH test, definitely within 3 days, but ideally, if they are looking after their area properly, they should have within 7 days rebalancing of the Candida albicans within the area. The pH balancing gel, ideal for women that are more on the sensitive side. So if they tend to have stimulation after they've had a depilation, meaning they're getting a little red or irritated looking, the pH balancing will help to rebalance the microcirculatory system within the area. So the soothing agent of the aloe and then lactic acid will help again with just getting rid of buildup. But the chicory extract is a prebiotic in this case, so it helps to create the environment for the microbiome to be in balance. And again, the microbiome, we want the lactobacillus bacteria to be more dominant than any other bacteria within the area. So you're always working towards ideal balance within the area. So a lot of women suffer from yeast infections simply because it's a fact of life with regards to being that part of the species. And if we can help our clients to be well educated as to the choices that they have, you might want to create little kits within your environment where you have a cleanser, where you have the zone control, and where you have the pH balancing formulas combined together, so that this kit is actually given to your clients that are looking for formulas that can help to balance the way their skin is functioning. If you're doing a waxing service and after cleansing and depilation or laser, the area is becoming a little bit more sensitive, I would recommend using the pH soothing gel to help to calm the area down. And again, you have your prebiotic, the chicory there, and the aloe vera to help to balance the skin. You're going to have a natural humectant, which is the hyaluronic acid, to attract moisture to the area without giving a greasy texture to the area, and a firming agent from the poodle line, and the bisbolol being an anti-inflammatory. So you have a combination of active ingredients that will help to change and shift the area, how it actually works. Sometimes when you're dealing with your more mature clients, they may become a little bit more sensitive after waxing, and as a result of it, they can become drier. I would recommend adding the regenerating serum to the balancing gel or using it by itself, as this actually helps to condition the skin to be more emollient, but also to help to alleviate some of the dryness client might be experiencing post-procedure. But in a normal situation, if we're talking about women that are starting to experience perimenopause, menopause, or postmenopause, they can naturally become drier. And the regenerating serum will help to condition the labia so that how it's more supple. But the introduction of the evening primrose, which is a natural progesterone, will help to condition the area so that it's a little bit better balance. As a reminder, as the woman is aging genetically, they are going to always have an issue with estrogen, progesterone, and testosterone and its balance. But a more dramatic shift occurring leads to reduction of secretions. And as a result of it, you have issues with regards to natural hydration or lubrication. And this is an excellent formula to help to condition the area so they may be more comfortable for any sort of intimacy, but also just for daily activity. And for those that are becoming active or are active, the Lubiel is a formula for lubrication. It is not for dryness. So please do not sell it for dryness. It is for intimacy. If you want for dryness, again, the previous slide was the regenerating serum. That is for dryness. This is a formula that with the aloe vera will help to give you slide. And it does have a bit of stevia, so it has a natural sweetness to the area, to the formula, sorry, not to the area, but it will give a little bit of sweetness to the formula. So if you happen to taste it, it would be fine, but it is free of synthetics. So you don't have any artificial fragrances. You don't have anything that will create a disruption because this is something that would be used internally potentially. And again, as I mentioned before, anything that's going internally into the body can create a shift with regards to the microbiota, and we don't want to introduce something that will create such a negative response to using something that will make a difference to your body. So for maintenance and anti-aging, we do have a toner, and as toners are really to help with the rebalance of the pH. If you are cleansing your body in a shower and using the foaming cleanser as an example that we have in the formulations, you will still be going towards alkalinity. Again, since water has a pH of 7, you're always going towards an alkaline state and you want your body to be in a more acidic state. So the firming toner will help to create a balance with the pH, but also will give tightness to the area. So again, we're talking about the outer labia. And the firming gel will help to create tone to the skin. So for those individuals that are concerned about the appearance of their genitalia, this will help to create a firmness or a tightness to the area. So you have your active ingredients to help to create some strength to the tone of the skin itself. And you are selling it as a kit, so you want to make sure that how the toner and the gel is being used in conjunction with the cleanser. For waxing or for sensitive skin, we do have a mask that can be used post. This is ideal not just for waxing, but for any sort of hair reduction with an IPL machine. We have our IPL 360 that can be utilized for hair reduction. And if you have clients that are a bit on the hypersensitive side, they should be prepared for the experience. There is a little bit of peppermint in this formula. It's spearmint in the as well, and it does create a little bit of tingling. So if you prepare them for the experience, they're not going to be stressed, but you have a vasoconstrictive effect with this. So it helps with tightening, but also reducing any sort of edema. And it can create a better balance or post-depilatory response from your service. So it's something that they can be using at home, or if you have an opportunity within your service to actually introduce this, please do. It takes about 10 to 15 minutes for it to dry, and then you remove it with warm to cool water so that how it makes a difference for that individual. And regarding depilation services, because we have to talk about the stages of hair growth, anagen, catagen, and telogen stages, we need to remind our clients that when you have depilation, whether it be with waxing or sugaring or with lasers, the cycle does make a difference with regards to hair growth and ingrown hairs, etc. We have created within the family of products an ingrown hair formula where the active ingredients is tiger nut oil, and tiger nut oil is known as an ingredient that has been used for generations to retard the hair growth. So this is something that is very gentle, very light, doesn't leave heaviness or oils to the area, and ideally, when you are using it after your service, the client should be going home with it, and it helps to reduce the potential for folliculitis, which is an inflammation of the hair follicle in that area. So we talk about all the things that we can do to help with Candida albicans, but we also want to talk about why, when we're doing our services, these things that we're recommending making a big difference in the long run with regards to what you're paying for or what you're looking for in your service can be better produced. So for your waxing service, if you want to go with your more mature clients or things that will be working to enhance your services after your waxing, removing the residue of wax or sugaring, or after your IPL, remove the residue of your gel. You would use your firming toner. You have your ingrown hair complex to use in the areas that are predisposed to it. And in the crevices between the leg and the vaginal area where you tend to have a lot of ingrowns, and naturally because of the compression in that area, you definitely want to be recommending it and using it in that area. And after that, using either the firming gel or the soothing gel, depending on what response they have post-depilation. So the complete range of products can help with daily hygiene, pH balancing, with recurring yeast infections or yeast infections, with menopause or dryness, irritation or sensitivity, and with ingrown hairs as well. We've been featured in quite a few magazines within the last couple of years because this is something the client is looking for and they're not necessarily able to find in the marketplace, meaning that how organically certified formulas that have been tested, that are safe, that are easy to use, and have a specific purpose and intent. So again, this presentation was sponsored by Derme&Co. I am the Director of Education for the US market. Nelly DeVust, a brand being around since 1946. Alaska, our formulations for miscellaneous. So we do have waxing supplies and other important tools that you might be using within your service. Druid, for those that are looking for formulations that are relevant to your marketplace, and the Druid BioLove formulations for those people that are looking for exclusive formulas only for your environment. And in the family of Nelly products, we have the Biotense line, which is with the green background for anti-aging, the Biofem with its pink background, the Biomedical line for acne vulgaris, which is, again, organically certified, and the Classic line, which has the red background. So I thank you for visiting me today. I look forward to seeing you next week on my next presentation, and I hope you have a wonderful day. If you have any questions, please feel free. I see there were no comments in today's presentation or questions, but please feel free to contact our representatives at Derme&Co to answer any questions you may have. Have a great day. Thank you for visiting.